So hi Tracy, good morning, good to see you today.
Morning Clare, how are you?
I'm good, thanks, I'm good. Thanks for sparing the time just to have a bit of a catch up. I know that everyone's incredibly busy. So as you know, before we got into this pandemic situation at Notts Healthcare, we were really keen to develop and implement a holistic staff wellbeing offer for all of our staff across the organisation, and think about how we might be able to support our health and care colleagues more broadly with health and wellbeing across the Nottinghamshire system. And last year we did quite a lot of work on that. We did a huge consultation exercise with all of our staff within the trust to ask them what a good wellbeing offer might look like. And one of the things and one of the points of feedback was one of the things that was needed to support that was about having a single point of access, somewhere where all staff could go to basically find out what they might be able to access. So we'd already got quite a few good things happening across the trust to support staff health and wellbeing, but it was they were done in discrete ways across the organisation, and not everybody knew about them. So taking that feedback, we decided to appoint a health and wellbeing lead, and I had the pleasure of interviewing you just before Christmas and making that appointment. So it's really good that you've been able to join us, and I know that you've only been with us for a few days, but what an amazing time to join. And this is an opportunity just to say, for me to say to you, a big welcome to Nottinghamshire Healthcare. So how are you finding things?
Well, as you say, it's early days, but what I will say is I've been greeted so warmly by so many people, many of the people that you've just explained, who are doing so much great work, often on top of their day jobs, to support their colleagues with their general health and well-being. So I'm really grateful that people have taken the time out of their busy schedules to welcome me and tell me a little bit about what they do, from mindfulness to mental health first aiders to physical activity and beyond, really. And I'm really excited to try and bring those agendas together so that everybody has the opportunity to access it and knows where to find that information. So yeah, it's been a really warm welcome.
So how much of a roller coaster has it been?
Well, induction by fire. Having come from an acute trust, I thought I was busy before, so I've come from University Hospitals of Derby and Burton, and we were the single provider of OCCI health and wellbeing services for all NHS in that region, so quite used to working with Derbyshire Healthcare as a mental health trust, Derbyshire Community and other acute trusts. So I knew it would be busy, but actually there's so much good work going on in terms of business as usual, as well as supporting people throughout COVID-19, and that's quite refreshing actually, because we've still got work to do as we go into the restoration and recovery, and I don't think that we should lose sight of that. So I'm really pleased to be part of that piece of work, really, and also the work that we're doing to support our colleagues in social care, in residential homes, and also our colleagues across the other acute trust settings as well. So it's great to be a part of that bigger picture, really.
No, that's really good, and as you said, you come with a wealth of experience that will be extremely valuable to us, and would have been in any event, but I think particularly in the current circumstances that we're in. In terms of you mentioned there that you'd been working in Derby. How long had you been in Derby? Just remind me.
Yeah, so 10 years, just over 10 years at University Hospitals of Derby and Burton, so a workforce of almost 13,000 employees, but within the patch, over 50,000 employees that we looked after on a commercial and a partnership approach. And I think one of the good things that I can take from that, hopefully, into Notts Healthcare is about scaling up that offer for the greater good, not only of our workforce, but also of the community that we serve. So really interested in that public health agenda and the information that we share with our colleagues that can be then to be taken back to their families or shared with their patients. And I know there's already a great amount of work already going on in the trust, so just to harness and build on that, really. And I think that's probably one of my key priorities for now and beyond.
That's great. So you touched on some of the things that you've been focused on in and it is in the days that you've been here so far. So if you can just talk to us a little bit about what you've put in place and what some of the key things are that you're going to be perhaps doing over the next couple of weeks or so.
Lovely. I mean, I must say that I'm building on a wonderful foundation from colleagues in the People and Culture Directorate who've done loads of good work already, so making my job a little bit easy for me, so I can't take all the credit for this. But one of the things I'm really excited about and wanted to share with people today is the new staff helpline that we're setting up, which will be a single point of contact for all employees who work in Notts Healthcare, also for the care homes within the region, and certain components for our colleagues at Sherwood Forest and Queen's as well. So this helpline will be a place where you can call, where you think you might need support, but you're perhaps not sure what you need, whether it's peer support, coaching, counselling, support with your physical health and wellbeing. So although the intranet page Connect is great, what we're looking for is just one quick call to a team of colleagues who are a fountain of knowledge really in terms of what's available, and they will triage and help work through what's the best service for you at the right time in the right place. And I think that's going to be a wonderful opportunity for people to get rapid access really. The second component for that, if I can just share it, is for staff members who may be experiencing acute distress, and how we can work with our colleagues to offer rapid access to the right support at that time, whether they recognise it in themselves or a colleague or manager might recognise that and want to call to say, how can I support this person? And I think really that is a unique offer that's available in Notts Healthcare that again will extend to our partners within the region. So really excited about that.
Brilliant. That's an incredible first few days, and it's brilliant to hear that we've got that single point of access for our staff, because that was one of their key asks really in terms of the consultation exercise from last year. So it's brilliant that we're able to set that up and that we can start to launch that. That's fantastic. Well, listen, it's been really good to catch up this morning, and I will see you and speak to you again soon in an appropriately socially distanced way, and look forward to continuing to work with you. Great work. See you again soon and speak soon. Is there anything else you just want to say?
Well, just to end on that the phone number for that single support and the email address will be available this week through the normal communications channels, probably the catchphrase of who you're going to call if you need support. So we look forward to receiving those calls and helping as many people as possible.
I'm sure that you do, and I'm sure there'll be some interesting responses to that particular catchphrase. So listen, it's been great to catch up, and what a brilliant offer that we're starting to be able to mobilise to our staff within the trust and our colleagues more widely across the health and care system. Take care, Tracy, and we'll catch up soon. Bye-bye.
Bye.